Thank you for joining us here at Doctor's Nutrition. I'm Dr. Jim.
And I'm Dr. Janine.
This is one of our series of deficiencies, deficiencies of various nutrients and so on. And today we're going to be talking about iron deficiency.
Yeah, iron deficiency is one of the biggies.
It is.
And it can cause a vast array of different symptoms. Fatigue is normally one of the big ones. I'm tired, I'm fatigued, don't feel like doing anything. We hear that a lot.
Yes.
Now, when somebody's iron deficiency gets a little worse, sometimes they have shortness of breath.
Yep.
And chest pain, and even an increased heart rate. You know, when you start again getting pretty deficient, people get dizzy, they get headaches. There's so many things that happen when you have an iron deficiency.
Even that dreaded restless leg syndrome, which we see a lot.
Yeah, when people come in with restless leg syndrome, I always say we got to rule out iron, B12, folate, and magnesium.
Right.
That's the big ones that actually can cause restless leg. Now, as having a bad iron deficiency in my childhood, the symptom that I always had was severe pain from my knees down. Mm-hmm. And it wasn't as much restless leg as it was pain. And I hear that a lot from other people.
It's just pain, yeah.
And unfortunately, the doctors told my mother that it was growing pains. So I went through a life growing up with pain all the time because they said it was growing pains. And when I got old enough to start doing my own lab work, that I found out it was an iron deficiency.
Yeah.
And over the years, I could tell when I needed more iron when my legs started hurting.
Yeah.
So there's no doubt when you have different weird pains that don't go away, don't just chalk it up as being normal. Try to find out what's going on, because that's one of those things that you don't have to live with, and it's really easy to help if you do have an iron deficiency.
Sure is.
Now, you also hear, depression's real big with an iron deficiency.
Yes.
And memory problems, and the cold hands and feet, and even hair loss, like a lot of the other deficiencies.
Yeah, I was going to say the dreaded hair loss.
And the iron deficiencies make so many different symptoms, because if you think about what iron does, it increases hemoglobin, and hemoglobin carries oxygen. So if you decrease your oxygen production, you're going to have all kind of strange symptoms.
Well, that's why you're going to have that fast heart rate, because the brain just says, okay, if the normal heart rate's not giving me enough oxygen, I'll speed up the heart.
Exactly.
That makes sense to the brain. Yep. So it tries. It's doing everything it can. And now, it's amazing how our body is a self-healing organism, and it tries everything it can to stay alive.
Exactly.
It's trying to stay alive, folks.
Now, one of the things over the years, if somebody comes in and says, I have the craving for ice, I chomp on ice all day long, you always have to rule out an iron deficiency, because that is a very common symptom that we see. Now, there is something called pica that is not that common. I do see it, and I have seen it.
We've seen it.
Where people want to eat strange things or have cravings for really strange things. And I have seen that be an iron deficiency. Yeah. I had someone call one time eating drywall. They were embarrassed to tell me what they were having, but they were eating drywall. They were even going to buy fresh drywall because they'd already picked their walls, but then realized that the paint probably wasn't that good. So they went and bought fresh drywall to not have paint on it. And I'm like, okay, we got to find out what you're deficient in.
They were thinking.
Because you're deficient in something when you start eating things that you shouldn't be eating. Now, I notice a lot of times when just looking at people, they don't normally notice it, but like if the white of your eye starts looking a little blue.
Yeah, I've seen some pretty blue ones,
bluish,
really. Yeah.
Bluish tint to the white of your eyes. And of course, everybody's probably heard of the pale skin being anemias. Yeah. So that is something that when you start having that, you might want to look for an iron deficiency.
Right. No doubt about it. Now, there's a lot of studies out there that have been done on this. And some of the interesting statistics, this is kind of spooky. 1 in 3 adults have some form of iron deficiency.
Yes, that was actually in a study that came out in September of this year.
In JAMA.
Yeah, so 1 in 3 adults. That's a lot.
That's a lot.
33.3% of the people have some sort of iron deficiency. When we say some sort, either a frank iron deficiency or an iron deficiency from another health issue.
Right.
They say in this article that it was one of the most widespread and under-recognized public health problems. So think about that. When that many people have a problem that goes undiagnosed.
Yeah, they said as many as 14% have what we call functional deficiency. Means they don't have enough to carry enough oxygen around their body, so they are really in
Right.
trouble.
And the 14% shows that they just have an iron deficiency.
Right.
It did not come from another problem. It
No.
didn't come because they had an intestinal problem that was bleeding. It didn't come from another issue. It was just they weren't getting enough iron. And, of course, your highest risk factor in that is going to be your premenopausal women, but that usually is because of your heavy cycles. In that article, which I thought was really interesting, that they found that even the people that were diagnosed with iron deficiencies, okay, this was people that were diagnosed, not the ones that were missed, the ones that were diagnosed. 3 years later, 58% were still unresolved, which means they still had iron deficiencies even when they knew it 3 years later.
That's kind of spooky.
I do. We see so many people say, oh yeah, I've got an iron issue, and they don't realize how important it is, or they took a very unabsorbable form of iron, which there's many of them out there, especially a lot of your prescription irons, and they made them sick. So they stopped taking it. That's what we see in people all the time.
Now, there was another study done in 22 that showed that 70% of the deficiency in kids and pregnant women go undiagnosed.
So they don't even know it.
They don't even know it, and the doctors that are treating them haven't looked into it. And think about that. Now, you've got a pregnant female that's developing a child.
Which normally gets some lab work.
Right. And they're developing a child. And we want this child to grow up and be a healthy individual, right? And there's 70% of them that are even undiagnosed.
One test that's done very regularly in medicine is a CBC.
Right.
And it was years and years and years ago, of course, they were saying, okay, if your CBC is okay, you're probably okay. Well, that is not true. So, a severe deficiency, yes, usually shows up in a CBC. You show a low hemoglobin, a low hematocrit, but we have seen many over the years that actually are completely normal CBCs.
I would put that number in the hundreds, if not close to thousands.
Normal.
Okay. Literally.
But yet, if you do their iron panel and your ferritin, you will see that it's low.
Right.
And an iron panel does like your total iron binding capacity. So it's what capacity do you have to bind iron?
Right.
And if your capacity is really high, it means you're deficient. And then it checks the iron in your bloodstream, looking at the number that's actually there. Then how much of your cells are saturated? And so there is the saturation. So if you don't have enough saturation, that can be a deficiency. Then we always check the ferritin, which is your stored iron. Your iron storage can also be deficient. You can be normal in your bloodstream, but low in storage and still make some symptoms. We tend to check all of it just to see where people are. But just because your CBC is normal does not mean that you do not have an iron deficiency. I think that's why so many people are missed, and it's why it's so underdiagnosed.
But one of the reasons this comes up is they say, well, if your CBC is normal, you're probably okay.
Yeah.
Probably, but
actually,
we don't know for sure,
iron deficiency is one of those things that I see in people that when it's fixed, it is so dramatic how they feel.
Oh, yes.
It is such a dramatic difference. So it does make a difference. It makes a difference in quality of life.
Yes.
If your CBC is normal and your iron is deficient, it might not kill you. It might
Hopefully, yeah.
But it will sure make symptoms.
Mm-hmm.
So that's what we see all the time. Now, when you start showing it up in the CBC, you're more severe. And that's probably one of the most common reasons over the years we've sent people to the emergency room. We get lab work back, and they are so severely anemic that they could pass out at any time. So at that point is when we usually do send them, because honestly, blood transfusion is the quick way to get it up.
Unfortunately.
But then you got to do something to keep it from falling right back down.
Yeah, and we have to also, at that point in time, you need to start trying to find out why.
The first question is always why.
Why?
Is it the reason? Or is it if it's a woman that's having a cycle? First question I ask them: are you bleeding heavy?
Yeah.
During that cycle, aren't a woman that's bleeding, or if it was a man or a postmenopausal woman, I always ask: are you bleeding from somewhere? Do you have hemorrhoids? I have seen hemorrhoids
yes.
about kill people because of the bleeding, and they're so severely anemic when we find it that they are barely there. But you can actually be bleeding from the intestines and not know it. A lot of times it can be bleeding that you don't know about. Now, pregnant women are known to kind of have iron deficiencies because they're kind of, growing a little baby inside of them.
They're eating for two. Okay.
Right? So pregnant women should always be checked.
Always.
And then your people with like IBS and ulcerative colitis and Crohn's and all your malabsorption problems, they can't absorb the iron properly from the stomach. So that a lot of your intestinal problems can cause it.
Yes. If you've had weight loss surgery, it's another one.
Yes.
They always tell you to, watch your vitamin B12, et cetera, and things like that.
They do tell you to watch your iron too.
And they do tell them, but
they don't.
For some reason, they don't hear it. It goes in this ear and it stops somewhere here and kind of fumbles around and falls out.
So many people over the years
side.
that's had bariatric surgery.
Yeah.
And they are told when they have the bariatric surgery done that you are kind of the rest of your life going to have to take these nutrients because you're not going to absorb them properly. So you have to take them long term.
Right.
And they don't always, for some reason, follow up. They might do that the first 6 months and then they say, oh, I'm okay. We've actually seen people about dead after bariatric surgery from nutrient deficiencies later.
Right.
So you've got to make sure that you are checking the stuff regularly.
Yeah.
Now, some people just don't get the iron from their diet. That's kind of like another reason.
And one of the things along that thing, if and we see this a lot more in guys than gals, so to speak. The guy is eating a horrible diet, drinking a gallon to a gallon and a half of tea a day, usually sweet tea, so they're getting way too much sugar on it on top of that. So if they're drinking something that inhibits the absorption of what little iron they do get in their diet.
Right. So tea is one of the things that inhibits the absorption of iron. If you do have an iron deficiency, never drink tea with your meals.
Exactly.
You can drink it, but in between meals. You don't want to, and definitely don't drink it with taking your iron supplement.
Yep.
Your sources, of course, are your beef and liver and greens and oysters and legumes and dark meat, chicken or turkey. So it takes the dark meat. It usually takes things that are kind of darker colors to actually get iron. So vegetarians, you can get theirs from the greens and legumes,
right?
But you got to make sure you get enough of it. When it also comes to what helps iron absorb, it's vitamin C. So vitamin C really helps the absorption of iron. So when you're talking about supplementation of iron, you always want a good form of iron.
One that can be absorbed.
One that can be absorbed, but you also want vitamin C with it. Now, the iron bisglycinate is one of your better forms of iron out there. Our Opti-FE is bisglycinate. It also has your vitamin C, but it has your B12 and folate to also help anemias.
Yeah.
So it's a blood building formula.
Right.
We also have a food-based iron. I like the food-based iron that we use because it tells you how many milligrams of iron you're getting. Some do not, and I don't like that because, okay, if it's food-based and you're only getting 1 milligram of iron, you're still only getting 1 milligram of iron. The one that we use, our Iron Response by an 8, it actually is 28 milligrams of elemental iron per tablet. So you know exactly how much iron you're getting. And that is the same amount of iron as our Opti-FE. So we use both of those really regularly.
Yeah, if the B12 is okay, it's an individualized basis. If the B12 is good, then we may just use the plant-based iron because, they've got tons of B12 and folate and so on. That's good.
But I
iron.
mentioned earlier that so many people stopped taking their iron because they took iron and it made them sick. Well, your normal high-dose ferrous sulfate out there is very unabsorbable. It hurts your stomach. It causes constipation. It causes problems, so people stop it. They don't realize the importance of getting that iron back to normal for overall health. If you've taken something like that and you say, oh, I can't take iron, it's not that you can't take any iron. You can't take that iron.
Yeah.
So you always want to try something else. Most people, our Opti-FE does not cause those problems.
Right.
And if somebody's really sensitive, I will use the food-based iron.
Right. It
does cost a little bit more, the food-based iron, but they're both really good. And so you really want to try to get an iron source that brings you back to normal. I have had so many people over the years that say, oh, well, I don't absorb iron. And they start taking one of our products and their iron is totally normal. And in the past, they even had to have iron transfusions. And it's because they tried unabsorbable forms of iron.
A lot of times medically, they'll use ferrous sulfate, okay? Go find Grandpa's truck, that rusty old bumper he's got, scratch off some of that rust, ferrous sulfate. Think you can absorb that stuff?
It's
I don't.
hard. It
It's
is hard,
hard.
and it does cause, when you don't absorb iron is when it causes constipation, because everybody out
Exactly.
there complains about constipation from iron.
Yeah.
And it's because it's unabsorbable. If it stays in the intestines and does not get absorbed, it is going to make things hard. So that's why you get constipation from unabsorbable iron. If you get a very absorbable source, it should not do that.
That's true.
So
Very true.
we just wanted to let people know iron is so important to get to normal, optimal levels.
Right.
But it is one of those things you just don't go out there and take a huge amount of without checking as well, because 7% of all men out there have iron overload, so have too much iron. So you can have some problems where you get too much iron.
Yes.
So you don't want to just do it again without checking. So if you have any of these symptoms that we talked about, which many people out there do, have your iron levels checked, have your, ferritin checked, have the CBC checked. But again, CBC can be normal and the ferritin and iron may not be.
Right. Exactly.
Yep.
Okay. Hopefully you got something out of this today. It's in our series of vitamin deficiencies and so on. And be sure and subscribe, hit the little bell button over there. And that way you'll be notified for any future upcoming events that we have or videos. So we want to thank you for joining us again. And hopefully you can live healthy
And be
be
healthy.
healthy.